I'm with Flatiron Health here at the World Conference on Lung Cancer. I presented a poster looking at the racial ethnic differences in real-world adverse events and overall survival. Patients who have advanced NSCLC who are receiving immunotherapy. At Flatiron, we're extremely committed to kind of shining the light on health inequities and disparities within cancer care. And so this had come up as a potential interest within our team. We knew that there are access issues with immunotherapies. And so we wanted to see if there were actually any differences amongst patients of color. Yeah, we use the Flatiron database, specifically looking at our lung cancer patients in our lung cancer EDM. And so we essentially looked at patients who received IO within the last, I believe, 8 years, and then calculated various outcomes such as time to a real-world adverse event, ones that are potentially related to IO therapies, as well as progression-free survival and overall survival. We found that patients of color tended to have fewer adverse events documented, but interestingly, they had better survival than white patients, essentially. And this could be due to like a variety of factors, such as patient reporting. It could be due to measures of quality of care, whether or not these clinicians are documenting whether or not these patients have had adverse events, right? Either would it be in the affirmative or the negative, right? And so these differences in chart documentation could be reasons for these disparities. They could be indicating, other underlying, quality of care measures as well. But also it could just be that patients of color do respond better to IO than white patients, right? We were unfortunately unable to fully look at this in our research, but that's what we were focusing on. It would be interesting to see if, again, it's just a documentation or lack of documentation, right? Real-world evidence is messy, unfortunately, and so it's not like a clinical trial where you're required to document all of these adverse events, right? And so seeing if we could look at actual look at the chart note quality and see if adverse events are just not there versus confirmed to not be there.